Hi, it's Cameron Kealy here, Osteopath and founder of the Migraine Solutions program again. And one of the questions we've had recently is from a couple of people about this new machine called the Cefaly. And the Cefaly is a device which is claiming to be able to prevent migraines and also to relieve them when you've got them. So let's have a little bit of a look. So it comes in a little pack like that, and it's got some electrodes, and basically what the Cefaly is a TENS machine. So TENS machines have been around since the 1960s, and what they do is they put an electrical current across skin, and what that basically does is it confuses the nervous system such that if you imagine if you've hurt yourself and you rub your rub your arm, the fact that you rub your arm puts a lot of stimulation in the skin around the area that you've hurt, and then what that does is it puts more input into the nervous system, and it decreases your pain. So thus, when you fall over and you hit yourself, you tend to rub it, and it feels a little bit better. What you're doing is you're stimulating the nerves around the area, and increasing the input into the nervous system gets a bit confused and you feel less pain. So that's kind of the premise of how the Cefaly works. It's called gate control theory, and they were used a bit in the past by manual therapists and physios, but they're not used so much these days, and I think the main reason is because they've been shown to not have a particularly lasting effect in terms of reducing pain. But having said that, they do give a definite short-term relief in pain in certain circumstances. One of the ones that it's commonly used in these days is pregnancy, and a lot of pregnant women do buy TENS machines and they put them on their back when they're giving birth, because it does give that short-term relief of pain in that situation. Other situations are chronic pain people, chronic low back pain people sometimes purchase these machines and they have them at home and they put them on their back, and in some cases it does give that short-term relief from the pain, even though it's not long-term. So the Cefaly, the unique thing about this is they've made the TENS machine small enough to put on your head and to give you some of that relief theoretically for your head pain. So we'll just jump forward. It's a picture from their website. So you've got your picture of the trigeminal nerve coming in there. That's that yellow thing, and they're putting an electrode on your forehead so that some of the parts of the trigeminal nerve there can get stimulated by the machine. And by all their research, it does give a reduction in an acute migraine situation, at least for some people. And interestingly, they claim that their studies are showing that it's giving a long-term improvement on migraine frequency as well, which is interesting. So let's have a look at how that could be the case. So if we've got a situation here where we have migraines and the migraines are causing pain, the effects of that is that you're going to get muscle tension, particularly in your head and neck and shoulders, and you're going to get stress hormones released, which in their own right are actually migraine triggers. So what you get is these effects of the migraine creating more migraine triggers, which gives you more migraines. So you have this kind of positive feedback cycle. So the Cefaly is going to come in and it's going to potentially reduce the pain of the migraines, which in effect breaks that cycle. So you're actually reducing the triggers, so you can in effect get fewer migraines. The other way that that's going to potentially work is the Cefaly is going to potentially get into that muscle tension just down there on the diagram, and it may potentially just get a relaxation of some of that muscle tension in the muscles across the forehead there. And so that the tension in that area is a known trigger for migraines, whether it be direct or coming in to affect the upper neck. And so there's a couple of ways that the Cefaly may actually potentially break this migraine circuit and give a longer term improvement where we're actually getting a longer term reduction of migraine frequency. So that is actually a plausible thing. But if we're looking at just using the Cefaly in isolation here, we've got to look at migraine prevention a little bit bigger, because people are, we just want people to be aware that if they're buying this, it's not a complete solution for migraine prevention, even though it may work quite well for some people. There are a lot of people who will get less impressive results, and it's because migraine triggers are there's a lot. So basically in this diagram here, we've got the brain chemistry, which is where your migraine's coming from. You've got your internal environment of your body and the external environment. If we break it down, the myofascial balance is the really big one that we start with, and the Cefaly is actually potentially getting some release in that myofascial balance. However, from an osteopathic point of view, there's a lot more going on in the myofascial balance that you've got to look at. There's tension in the upper neck, there's tension in the jaw, there's potential asymmetries in the myofascial across the head, and the Cefaly is going to affect the front bit of that. So if you're holding a lot of your tension there, you might get really good results with the Cefaly. But if you've got a lot of tension, say in one side of your jaw, or you've broken, your nose, or you've got an upper neck problem, which is, one of the really key areas is that upper neck. The Cefaly actually hasn't got a direct way of releasing any of that myofascial tension, so it doesn't actually address that whole spectrum of things, even though it may give some really good results for some people. And while I'm sure the Cefaly is not claiming to be a device which covers all your migraine triggers, there's a lot of other things there. There's dietary issues, and there's your stress responses to certain situations, let alone all of the external things like exercise and a lot of those external things which you can't control, smells in the environment and noise as well. So the way that we generally kind of suggest to look at things is to look at that musculoskeletal system, or the myofascial system, another way of calling it, and addressing that first and getting changes in that can often mean that you don't need to worry so much about the ones above it. But just put that in there just to show that spectrum that you want to be looking at if you're trying to prevent migraines, because all of these triggers will accumulate, and the Cefaly will address a component of it, but it's certainly not a comprehensive way of trying to prevent migraines. And just threw that in there because that's usually the way that people do try and address migraines. So instead of having this lovely pyramid addressing all of these areas, people are just taking medication. And one of the benefits of the Cefaly is that it isn't a drug, and so there's no side effects. All medications have side effects, whether you notice them or not. So while medications can be a godsend, they do, there are potential, long-term side effects that are involved with medication, which you will not get with the Cefaly. So we get a tick in that regard. So if we're just going to do a summary, little scorecard there. So Cefaly may be useful for acute management of migraines for some people. It may help you relax. It's got a setting on there which you can use for relaxation, which is a lower level setting. And I've already had feedback from one patient already that they did find that a useful thing. So stress being a migraine trigger, like we kind of looked at with that feedback cycle, it may actually help relax you and thus reduce your long-term migraine frequency in that regard. Prevention, it can form a component of a prevention strategy for a lot of people. It's going to be more effective for some people than others, depending on where the tension is around that myofascia around the head. But it may be beneficial for you for prevention, so I gave it a half. Drug-free, big tick. Once again, anything which can prevent migraines without the side effects of drugs is a wonderful thing, even though, as I always say, medication can be wonderful for a lot of people, can be a godsend. If we can avoid it, it can be a very, very nice thing to avoid all the side effects that you get with drugs, and potential addictions to certain opioids and things that people are taking for migraines. Non-irritating. If you're going to go and get a massage when you've got a migraine, it's probably going to be really irritating and it may flare up the migraine. Things like acupuncture, where you're just getting needles, and a TENS machine can actually have a lower level of irritation, and you can manage it yourself. Just some crosses on here. It's not specific to the myofascial tightness, so once again, they're probably not claiming that the Cefaly is a complete cure for everything, but if we're looking at a bigger picture, there's a lot of tension in the myofascia, like through your jaw, through your upper neck, potentially through the myofascia itself around the skull, which may actually influence the pliability in the bones and potentially even the dura on the other side. We're not going to talk about that now because that's a big video. We'll do another one on that. But the Cefaly is it's only going to address this front component. And obviously it's not going to address all the other triggers that may be relating to your migraines: diet, lifestyle, alignment of the rest of your body. If you've got a big low back problem, then it's not going to help too much with that. But all in all, it can be a useful device. It is expensive. They're about $400 in Australia to buy, so it's a little bit of investment, but there's certainly some research behind it to show that it can be effective for acute management and a little bit for long-term prevention as well. So if you are suffering migraines and you are having long-term problems with them, it is something that you may want to consider. And if you did want some more information on migraine prevention, just go to migrainesolutions.com.au and download your free ebook, 7 Secrets for Migraine Prevention. There's some great ideas in there. A lot of people are unaware of on how to prevent migraines, with a lot of them being non-medication methods. And if you're in Melbourne, Australia, you can also get your free one-to-one diagnostic session on how to prevent migraines and a tailored program for you to prevent migraines in your particular circumstances.
migrainesolutions.com.au